By having a colonoscopy, it could save your life, although it might be for some people a little bit uncomfortable for a very short time. It could mean everything to their treatment and to the rest of their life.
When the patient is referred over to the booking team, the instructions are then either given over the phone as well as we send them out paper copy with all the details that they need.
The appointment letter just gives you the date and the time and whereabouts you've got to go. The leaflet just gives you a brief resume of what the procedure is. So it's like a small informative leaflet, but it's not a frightening leaflet.
The pre-assessment is mainly for patients that have complex medical history, also that are on anticoagulation tablets, so blood thinning tablets. So we generally invite the patients to come to see us. Otherwise, we will give them a ring and just do the pre-assessment over the phone. Obviously, ask you to be in somewhere quiet where you are able to discuss confidential information about yourself. We tend to advise patients for the week prior to the procedure to have what we would describe as a light diet. But 48 hours prior to the procedure, ideally you should have the low-fiber diet. The cleaner your bowel is, the better the views are going to be, so we'll be able to give you more accurate results following the procedure. So it's important that you try to follow the dietary advice as much as possible. The laxative has to be prescribed. If your appointment is in the morning, you will need to start the day before in the morning, so you will drink 1 litre in the morning and then the 2nd litre in the afternoon. If your appointment is in the afternoon, you would take the 1st litre the day before in the afternoon and the 2nd litre on the day of your appointment in the morning. Nothing is going to happen straight away, so it's not something that you would need to rush to the toilet. It's just when you start taking the 2nd litre, generally that's when things starting to happen.
It's 2 litres to use as a laxative to clear the bowel. It does feel something quite alien to have. So I decamp it into about 4 or 5 glasses and have a straw so it's not going all over your mouth, and then just keep sipping. When they send you the leaflet, the map shows you the outline of the hospital and where everything is, and it also gives you if you're coming by bus, it tells you which bus to get on and where the bus stops are.
When you arrive in the apartment, you will get greeted by the receptionist, and she will alert one of the nurses that you are here. The nurse who's going to do your admission then will come and collect you, take you through to a private room, go through the admission process, which will cover medical history, will cover the reason for your visit, so why you're here, and take informed consent at that point as well. We will tell you exactly why we're doing it and the reasons behind it, and also we will discuss with you about the potential risks. There is a risk of perforation, so perforating your bowel or puncturing the wall of the bowel. There is risks of bleeding, especially if we are going to take a polyp out or some biopsies. The risk of having any problems following this procedure is extremely low. Any point in time that you do change your mind, you can withdraw consent. We will place a wristband on your wrist, and that will have your basic details. You'll have your NHS number, you'll have your name and your date of birth. Is part of our safety checks. We will take your vital signs, your blood pressure, your pulse, and we'll also be placing what we call a cannula, which is just a little plastic tube that sits at the back of your hand, so we can give you the sedation and any other medicines that we need to give you at the time of the procedure. Once we've gone through the admission process, we will ask you to get changed into a hospital gown. We tend to advise patients to have sedation because it's quite a lengthy amount of bowel, and sometimes it can be a little bit uncomfortable, so we always promote sedation. Some patients choose not to have sedation, and that's absolutely fine, but if you do have sedation on the day, it's important that you have somebody to collect you. So if you are coming through with public transport, that's fine, but you'll need to get somebody to collect you. In terms of waiting, it's not a quick procedure because there are other patients that are also having things done, and sometimes it's difficult to predict how long they're going to be.
It can be 20 minutes. Half an hour, I think, is the most I've ever waited. But the nurses come and reassure you it's not going to be too much longer. So you're not sitting there just worrying yourself.
When you come into the room for the colonoscopy, you will have the endoscopist, which is generally a doctor, and you'll have two nurses. One of the nurses will be assisting the doctor with the procedure, and the other nurse will be there just to look after you. So they'll make sure that you're okay. They will talk to you if that's what you want them to do.
You just have to be slightly over the side of the bed. The fetal position seems to be the best position in order to do that. It's more of a comforting position. It's often the position we sleep in, and so it's not an alien position that they've asked you to be in.
Sedation is what we call a conscious sedation, so it's not a general anesthetic. It's something that will relax you. It can make you drowsy and sleepy, but you are awake throughout, and the reason for it is that we may ask you to change position slightly in order for us to advance the camera, and obviously you need to be able to comply with that.
Sedation is just a way of settling you down. I don't feel sleepy, but I feel more relaxed. The nurse usually sits in front of you, and they're very reassuring and very, very caring, and that makes all the difference. You just don't become all worked up about anything.
We will be monitoring your vital signs, so your blood pressure, your pulse, your oxygen levels. With the sedative, there is also always the potential that your blood pressure may go down a little bit, so just to make sure that you are safe, and if that happens, so there is things that we can do to help you.
When the scope first goes in, because no matter how cool, calm and collected you are, it's not a natural thing that's happening to you. You kind of get used to it, and then when the scope turns the bend, as I call it, or turns a corner, it feels like butterflies, and that can be a little bit discomfort, but not desperate pain or anything.
It's very individual. Some patients find it absolutely fine with no problems at all. Others do find it a little bit more difficult, but it's tolerable, and patients manage it perfectly well, and we are very good at keeping an eye on in terms of pain, and if we are in discomfort, we can address that pretty quickly. For a very straightforward colonoscopy, diagnostic, nothing found, can be anything from 10 minutes. If we were to find any polyps or anything that we need to do within the bowel, it can take up to an hour or more.
It's so quick. I mean, it never is more than half an hour, and it really isn't.
Polyp is a little growth in the bowel. It's a little bunch of cells that are in the bowel. Majority of the polyps are completely benign, and they will never cause you any problems. But there is a certain type that can in time develop into cancers. So as a general rule, we tend to remove all the polyps and send them to histology for classification.
In fact, the funny, strange thing is you only feel it at the very last bit as the scope comes out. You don't actually feel it once it's been all the way round. You feel it just at the very last bit when the scope is finally taken out.
You may experience a little bit of cramping pain, and you'll definitely feel a little bit bloated. And the reason for the bloatedness is that we do inflate your bowel with air, and that kind of just stretches everything, so we can have a good look around. That in itself will make you feel quite bloated. Once the procedure's over, we will take you through to the recovery room. There you'll be greeted by another nurse who will be taking over your care. If we did anything to you, such as a polypectomy, we will just be looking for make sure that there is no bleeding. We will keep an eye, continue to keep an eye on your vital signs, make sure that everything is fine, and once you're nice and awake and you feel well enough, then we will be offering you something to eat and drink. You may experience a little bit of trapped wind or just a colic discomfort in your abdomen, and that's quite normal. You also may have a little bit of bleeding from the back passage when you have your bowels open, especially if we did any biopsies or polyps removed, and that's again expected. Large volumes of blood isn't, so we will advise you on discharge as to what to look for, but you should be feeling well.
If you've got the cramps, you don't feel like eating straight away, but the important thing is to drink. So to drink something and then have something light for about 24 hours. When you feel you want to, you go and get yourself dressed back in the changing room, and then you go and see the nurse that will tell you how it all went. She discusses the findings with you, and any questions you've got, she answers them. It's nice because it's maybe quite a few weeks before you actually see your consultant again. So you're not going home thinking, oh, I wonder if they found something else, because you can ask all of it. I think that's excellent, really.
What we tend to advise you after the procedure is, because you may still have the laxative within your body, it's important that you are mindful that the first meal may go through quicker than normal. We will be giving you a discharge aftercare leaflet, which will tell you what to look for, what is normal, what isn't normal, what you can and can't do post-procedure, and you will also have telephone numbers there. Our telephone number, that you can ring us for any advice, and out of hours telephone numbers should you require.
It's really just a case of just taking it easy and realising you've had a sedation, which is doing what it says, sedating you. So until that's got out of your system, just chill a bit.
For the 24 hours following the procedure, it's important that you don't spend that time on your own, so you'll have a responsible adult with you. We don't advise you to drive, have a bath unsupervised, look after minors, or sign any legal documentation for that period of time. If you do decide to do some cooking in the kitchen, make sure there is somebody around with you, because obviously kitchen utensils and that sometimes can be risky. So just be sensible, really.
It's hard to say to somebody else, don't worry. I'm very good at giving advice and rubbish at taking it myself, but it isn't to be feared. Everybody's really kind. I've never been frightened. I mean, the staff here at this unit are amazing. You have symptoms and you don't know why, and the colonoscopy is the only way to actually find out. What you don't know worries you more than what you do know. That's how I feel about it.
A colonoscopy is very useful in the prevention of colonic problems, especially if we're talking about cancers. There are other conditions within the bowel that are treatable. By knowing that you have it, we can do something about it. If you've got a procedure booked, we will look after you.